Okay, so good morning. Today I will report about iron deficiency and the types of anemia. This is the table of contents. We do have introduction, objectives, anatomy and physiology, nursing care plan, drug study, laboratory test, types of anemia, pathophysiology, reference and members. Introduction. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity according to the World Health Organization. This means that health is a resource to support an individual's function in wider society rather than an end in itself. A healthful lifestyle provides the means to lead a full life with meaning and purpose. The best way to maintain health is to preserve it through a healthful lifestyle rather than waiting until sickness or infirmity to address health problems. People use the name wellness to describe this continuous state of enhanced well-being. Iron deficiency is a nutritional disorder. It happens when you do not have enough iron in your body. Iron deficiency is usually due to blood loss but may occasionally be due to absorption of iron. But how can we battle ourselves to avoid from getting sick? Can we make our body healthy and free from any diseases? What will you do to prevent infections that causes sickness in our body? So we do have two sources of iron absorption. First is through the heme iron from hemoglobin in meat and fish, which is reduced in ferrous form, and it is highly absorbable. And when it goes to stomach, the heme containing iron in ferrous form is hydrolyzed from protein globin component. Then it goes to small intestine. The ferrous remains soluble as it is bound to proteins and is absorbed through enterocytes. These are the samples of heme iron. So these are animal based, like blood, liver, red meats, fish, and poultry. Next source of iron absorption are non-heme iron from plants in the oxidized ferric form, which is less absorbable compared to heme iron. Some ferric reduced to ferrous in acid conditions of the stomach. Then it goes to the small intestine. Some ferric forms insoluble complexes at high pH of small intestine, lowering absorption rates and increasing excretion. And these are the samples of non-heme iron. So these are plant-based, like dandelion, raspberry, pumpkin, sesame seeds, flax seeds, legumes, beans, lentils, peas, hazelnuts, red beet. The benefits of iron: it helps to transport oxygen around the body. It is important for a healthy central nervous system. It plays a role in energy metabolism. It will also alleviate tiredness or fatigue symptoms. It is important for a healthy pregnancy. It will also improve sports performance. It may protect cognitive health in older adults. It is an important cofactor for various enzymes. And a sufficient intake can prevent or treat anemia. This is the anatomy and physiology of iron, the normal iron balance and the iron deficient. So when when you have an iron balance, so when you intake iron 300 milligrams, then it goes to tissue, it will store about 1000 milligram for men and 400 to 1000 milligram for women. Then it will form red blood cells, which is 2500 milligrams. So the normal cell turnover and sloughing, which has iron containing cells, and there will be micro erosion. This is the physiologically normal bleeding. And then on the other part, when the patient has an illness, when the patient is sick, like for example, the patient has ulcer, so there is an occult in bleeding. So when taking the iron, the absorption increases 2 to 3 times, and there will be loss about 3 to 5 milligrams iron due to gastrointestinal menses because of the bleeding. So the pathway when taking iron in 300 milligrams going to the tissues, there will be no storage, and the red cells is around 2000 milligram. So the patient is anemic or has iron deficiency, anemia. Other causes of anemia, there are 3 factors. These are demographic factors, dietary factors, and social physical factors. Demographic factors are elderly, teenager, female, immigrant, aborigine, and widower. For the dietary factors, these are low iron, heme iron, low vitamin C, excess phytates, excess tea or coffee, fat diets. And then for the social physical factors, these are due to poverty, poor detention, candle burning, alcohol abuse, gastrointestinal disease. So, for example, a widower doesn't like to eat like iron-rich foods. So, because of being depressed, depression, due to depression. And then second example, teenager or elderly has low iron in the body. It's because due to poverty. It can also be due to alcohol or poor detention. And then for elderly, and an elderly is not taking iron-rich foods, so that patient may develop gastrointestinal disease. And these are the signs and symptoms of low iron. So number 1, first, mental fatigue, feeling mentally tired, irritable, dizzy, or losing concentration quickly. Mouth ulcers, sore, white patches on the inside of mouth or sore. Red flaky cracks at one or both sides of mouth. Infection may cause more infections than usual, such as cough and cold. Shortness of breath, reduced physical capacity. Craving non-food, cravings to eat ice or non-food items such as clay, dirt, ash, and starch. Restless legs, a disturbing need to move legs even when resting. Hair loss, losing clumps of hair or more hair than normal. Headaches, repeated headaches. Sore tongue, affects the surface of the tongue, making it feel sore or give dry mouth. Paleness, most noticeable on the face, nails, inner mouth, and lining of eyes. physical fatigue or exhaustion, so feeling physically tired. Brittle nails, chip and crack easily. Cold intolerance. Cold hands and or feet may mean that there is not enough oxygen being delivered in the blood. Nursing care plan. Patient's name Miss Ni Wang, 30 years old, female. Date of admission and time January 27, 2021, 7 a.m. in female ward. Assessment. Subjective. Wala po akong ganang kumain. Nanghina po ang aking katawan as verbalized by the patient. Objective. Blood pressure 110/70 millimeters of mercury. Temperature 36.5 degrees Celsius. Pulse rate 80 beats per minute. Respiration 15 cycles per minute. IVF plain NSS 1 liter at 120 cc per hour infused on right carpal 32 to 33 drops per minute. Complete blood count result: hemoglobin 90, hematocrit 0.35, low mean corpuscular volume 75, low mean corpuscular hemoglobin 28, elevated platelet count more than 450,000, elevated white blood cell count 15 times 10 raised to the power of 9, capillary refill test 2 to 3 seconds, pale skin, weak looking, cold hands and feet, fatigue, shortness of breath noted. Diagnosis: imbalanced nutrition, less than body requirements related to the inadequate food intake to utilize nutrients as evidenced by loss of appetite and muscle weakness. Planning: within 8 hours of nursing intervention, the patient will verbalize increase in energy and perform desired activities as evidenced by consuming iron-rich foods. Interventions with rationale. First, establish rapport to gain patience, trust, and cooperation. Second, vital signs taken and recorded to have a baseline data. Third, intravenous fluid checked and regulated to avoid complications. Fourth, monitored complete blood count result to monitor iron, hemoglobin, white blood cell, platelet level. Fifth, assess patient's ability to perform normal tasks or activities of daily living. This influences choice of interventions or needed assistance. Sixth, encourage the patient to eat foods that are high in iron such as spinach, legumes, liver, and other organ meats. This is to maintain body nutrition and energy. Seventh, encourage patient to eat more and to drink more water and fruit juices to increase appetite and hydrated. 8. Administered medicines as prescribed to increase iron and hemoglobin level. 9. Encourage patient to consume foods that are rich in vitamin C to enhance absorption of iron-rich foods. 10. Provided a quiet atmosphere, this will enhance the patient's rest. 11. Elevated head of the bed as tolerated to enhance lung expansion to maximize oxygenation for cellular uptake. Evaluation: after 8 hours of shift, the patient was able to consume iron-rich foods, therefore goal partially met. Drug study. Generic name, iron sucrose injection, brand name Venofer. Classification, iron supplement. Mechanism of actions, exogenous source of iron that replenishes depleted body iron stores and is essential for hemoglobin synthesis. Indications per dosage: iron deficiency anemia in patients who are hemodialysis dependent. For adult, give 100 mg per 5 ml of element iron via IV directly in the dialysis line by slow injection over 2 to 5 minutes, or by infusion of 100 mg diluted in a maximum of 100 ml normal saline solution over 15 minutes per consecutive hemodialysis season. Interactions: drug to drug. Oral iron preparations may reduce absorption of oral preparation, so avoid using together. Contraindication: it is contraindicated in patients with hypersensitivity to drug or its components, evidence of iron overload, or anemia not caused by iron deficiency. Adverse reactions: headache, fever, hypotension, chest pain, hypertension, nausea, vomiting, diarrhea, abdominal pain, dyspnea, wheezing, and rash. Nursing interventions: assess patients' ability to perform normal tasks or activities of daily living. Note changes in balance or gait disturbance, muscle weakness. Recommend quiet atmosphere, bed rest if indicated. Elevate the head of the bed as tolerated. Provide or recommend assistance with activities or ambulation as necessary, allowing patient to do as much as possible. Then laboratory test. First, complete blood count. So this is the normal range of each parts of complete blood count for male and female. This is to see how many red blood cells. So for the hemoglobin, this shows the amount of the protein in your blood. So if you have anemia, your hemoglobin will be low. It is what gives red blood cells their color. Next, hematocrit. This shows how much of your blood is made up of red cells. Mean corpuscular volume, the average size of red blood cells in a blood sample. Mean corpuscular hemoglobin, the average mass of hemoglobin per red blood cell in a blood sample. Mean corpuscular hemoglobin concentration is a laboratory value found on a complete blood count that describes the average concentration of hemoglobin in a given volume of red blood cells. White blood cells, representing cells that protect the body from infection. It is usually normal or slightly low. Then, white blood cell differential identifies and counts the number of 5 types of white blood cells, such as neutrophils, lymphocytes, monocytes, eosinophils, basophils. The individual count can be reported as an absolute count or as a percentage of total. Platelets, responsible for assisting in blood clotting, may increase initially in iron deficiency but often drop in number as the anemia becomes more severe. Second, lab test, peripheral blood smear. This is looking at the size and shape of red blood cells. So in iron deficiency anemia, the red blood cells are smaller than the usual. So this is the normal and this is the abnormal. Third lab test, serum iron, total iron binding capacity, serum ferritin, and transferrin saturation. Serum iron 50 to 150 micrograms per deciliter. This measures iron levels in serum, represents iron that is almost completely bound to transferrin. Total iron binding capacity 300 to 360 micrograms per deciliter. This measures the transferrin capacity to bind iron. Serum ferritin 50 to 200 micrograms per liter. This measures the body's ability to store iron. Transferrin saturation 25% to 50%. This measures the levels of iron carrier. Then fourth, lab test, reticulocyte count test or retic count. This measures the number of reticulocytes in the blood. If the count is too high or too low, it can mean a serious health problem, including anemia and disorders of the bone marrow, liver, and kidneys. So these are the causes of abnormal reticulocyte count. When there is a decreased retic count, this may be due to bone marrow failure, chronic disease, folate deficiency, infection, iron deficiency, liver disease, malignancy, pernicious anemia, vitamin B12 deficiency. When there is increased reticulocyte count, this is due to hemolysis, hemorrhage, leukemia, pregnancy, recovery from vitamin B12, folate or iron deficiency, sickle cell anemia. So this is the formula. Percent retic count equals reticulocyte count times 100 over 1000 red blood cells. So the retic count for adult, this will range from 0.5% to 1.5% or 0.5% to 2%. Range may be slightly higher in women or people living in higher altitude, higher than 6,000 feet above sea level. Newborns 2 to 6%, but drops within 1 to 2 weeks. Absolute number 10 to 110 times 10 raised to the power of 9 per liters. Fifth lab test, fecal occult blood test or FOBT, is a lab test used to check stool samples for hidden occult blood. The occult blood in the stool may indicate colon cancer or polyps in the colon or rectum, though not all cancers or polyps bleed. So these are the three types of fecal occult blood tests. We do have the Guillac smear test, fecal immunochemical test, and flushable reagent pad. Then types of anemia. So we do have three types of anemia. Hypoproliferative. This is resulting from defective red blood cell production. Then bleeding, resulting from red blood cell loss. And then hemolytic, resulting from red blood cell destruction. Okay, so for the hypoproliferative anemia, the types are iron deficiency, vitamin B12 deficiency, folate deficiency, decreased erythropoietin production from renal dysfunction, cancer, or inflammation. The causes are inability to produce adequate numbers of red blood cells. Decreased red blood cell is reflected by a low or inappropriately normal reticulocyte count. Third, marrow damage due to chloramphenicol, benzene, lack of iron, lack of vitamin B12 and folic acid. Iron deficiency anemia. This is inadequate iron intake for hemoglobin synthesis and the most common type of anemia in the world. Megaloblastic anemia. Lack of vitamin B12 and folic acid. The bone marrow produces unusually large, structurally abnormal, immature red blood cells or megaloblasts. Anemia of inflammation. This may be due to chronic disease, infection, or malignancy. Aplastic anemia. Decrease in or damage to marrow stem cells, damage to the microenvironment within the marrow, and replacement of the marrow with fat. Second category, anemia of bleeding. So this is bleeding, kinds of bleeding from gastrointestinal tract. It can be due to epistaxis or nosebleed, trauma, bleeding from genitourinary tract such as menorrhagia. Causes of GI tract bleeding, hemorrhoids, peptic ulcers, tears, or inflammation in the esophagus, diverticulosis and diverticulitis, ulcerative colitis, and Crohn's disease, colonic polyps, or cancer in the colon, stomach, or esophagus. Causes of epistaxis or nosebleed. Local trauma is the most common cause, followed by facial trauma, foreign bodies, nasal or sinus infections, and prolonged inhalation of dry hair. Children usually present with epistaxis due to local irritation or recent upper respiratory infection. Causes of trauma: when a body part collides with something else, usually at high speed, like car accident, physical assaults, and falls. Causes of menorrhagia can be caused by uterine problems, hormone problems, or other illnesses. Other causes include growths or tumors of the uterus that are not cancer. And it can be also cancer of the cervix or uterus. Hemolytic anemia. Types of hemolytic are altered erythropoiesis like sickle cell disease, thalassemia, and other hemoglobinopathies. So usually these are inherited diseases. Next, hypersplenism due to hemolysis. Next, drug-induced anemia. Next, autoimmune anemia. And last is mechanical heart valve related anemia. So causes of hemolytic: the red blood cells have a shortened lifespan, but the number of circulation is reduced. Elevated retic count: the fraction of indirect or unconjugated bilirubin is increased. So sickle cell disease or sickle cell anemia. People with this disease have atypical hemoglobin molecules called hemoglobin S, which can distort red blood cells into a sickle or crescent shape. Thalassemia: an abnormal decrease in the hemoglobin content of RBCs, extreme microcytosis, smaller than normal erythrocytes. Hypersplenism, hemolysis, a common disorder characterized by an enlarged spleen which causes rapid and premature destruction of red blood cells. Then drug-induced anemia, a blood disorder that occurs when a medicine triggers the body's defense system to attack its own red blood cells. Autoimmune anemia, malfunction of the immune system that produces an antibodies attack red blood cells as if they were substances foreign to the body. Some people have no symptoms and other people are tired, short of breath, and pale. Mechanical heart valve related anemia. Hemolysis usually results from the structural deterioration of the valve or a paravalvular leak. And then G6PD or glucose 6-phosphate dehydrogenase deficiency. This is a gene which is the source of the abnormality in this disorder. So this is the pathophysiology. So the last one is the pathophysiology. This will be explained by Miss Vuna. Okay. This is the reference. Alright. Thank you for watching. Bye.